Hello everyone, it's Dr. Neeraj Pandya. A lot of Golden State Warriors and Sacramento Kings fans have questions about De'Aaron Fox's finger injury. Here's a quick breakdown of finger fractures in general, what determines if an athlete returns to play, and what exactly is an avulsion fracture. Now, the first important thing to understand is that many times athletes will suffer a finger injury, but they can continue to play because the pain and swelling and sometimes the adrenaline from the game itself will not actually stop them from performing on the court. But then when that pain and swelling begins to set in, many times hours after they've actually injured it, an x-ray may show an injury such as a fracture has actually occurred. The second important thing to understand is not all finger fractures require surgery. If the fracture is stable, the bones are relatively aligned, there's a minimal risk of that fracture actually moving, or it's in a non-critical location, many fractures can be treated without surgery. But that doesn't necessarily mean that athletes can return to play if they don't need surgery. There are multiple factors that go into determining whether an athlete can return to play with a finger fracture. First of all, the athlete has to have good pain control, they have to not have a lot of swelling, and they also have to not have a lot of stiffness. If those things are under control, then an athlete also must be able to protect the area to make sure that there's not further injury. So sometimes, even though they may have control of pain, swelling, and stiffness, sometimes the taping or the bracing that they'll need to do to protect that injury may make it difficult for them to play, such as in the index finger of a shooting hand. The next thing to understand is that what exactly is an avulsion fracture that was just reported by the Sacramento Kings. An avulsion fracture is when a piece of bone is actually pulled off by a ligament or tendon. Now, there was a report in the media that this was an injury to the tip of his index finger. So what that basically entails is that this bone, which is called a distal phalanx, has basically three main structures that can pull off a piece of bone. You've got your extensor tendon, which is basically on the top part of the finger that helps to basically bend at this joint. You've got your flexor tendon, which helps to bend at this joint down, and then you've got the ligaments, which help to stabilize the joint. All those structures can potentially pull off a piece of bone. The key thing to understand is that case, not only do you have a piece of bone that needs to heal, but you also have a ligament or tendon that may not necessarily be doing the job that it needs to for that finger to function. The key thing is that when you're looking for an athlete return to play, number one, you need to make sure you have a fracture that won't get worse, that will heal on its own. Number two, all the clinical signs, the pain, the swelling, the stiffness has to be under control. Number three, they have the bracing or taping that will help to protect the fracture, needs to not inhibit their play. And number four, if it is an avulsion fracture, what has pulled off that piece of bone needs to not impact finger function. So if you have an injury to the flexor or extensor tendon and you can't actually move that finger, it can impact play. Or if an injury to the ligament, which makes that finger unstable, even though the bone piece may be small, it can make it very difficult to return to play. The exact fracture pattern and the clinical symptoms of the patient will determine whether an athlete can play and taking in the risk of further injury. Thank you.